Hello, everybody, and welcome to the High Level Shade Show. I am so excited about this five-part series that we have for you guys this week. So, the way we're doing this series is if you guys follow my platforms on YouTube, on TikTok, then you know that we do these medical moments and we go over the diagnostic processes of certain diseases that are, prominent and just so running rapid today, such as like cancer, ADHD, autism, diabetes, cardiovascular issues, neurological issues, and so much more. And so, when we had the opportunity to be here on the Kingdom Purpose Radio and Kingdom Purpose television app for this app release week, my team and I decided it was a great idea for us to bring those episodes onto the Kingdom Purpose television platform. So, the shows that you are going to be tuning into this week are pre-recorded shows. And I am just so excited to have the opportunity to be able to share that with you. So, just a little FYI, today's topic is going to be about cancer. It's abnormal rapid cell growth. We're talking about cancer, all different forms of cancer, and I'm so excited to share that with you. Be sure to remember to like and share this information with others. Be prepared for this week. We have a slew of other topics that we will be tackling, such as, like tomorrow's topic, for example. We're going to be discussing the male and female reproductive issues. And then Wednesday, we're going to be discussing Bell's palsy and a neurological issue. Thursday, we're going to be talking about autoimmune diseases. And we're talking about multiple sclerosis. We're talking about just fibromyalgia. We are going to be tackling so much on autoimmune disease. And I pray that you all are tuning into that show. That is a show you will not want to miss. And then Friday, we have a surprise topic. And I am so excited about Friday's topics for sure. So, without further ado, we're going to go ahead and get into the show. And I hope that you enjoy it. God bless y'all. And thank y'all for tuning in to the High Level Shade Show. Here we go. The unshakable woman with the beautiful Cheryl Staber. So today we're going to be discussing cancer, and I'll be co-hosting on her platform. So thank you. Be patient with us on this show. Thank you for joining this show. Save all your questions until the end, okay? God bless you.
All right. Thank you so much, Dr. And also here, Shantavia.
Yes.
This is the Unshakable Woman podcast. We are doing things a little different. We're only just audio, but we are audio and vision for today. We are starting a 5-week series.
Yes.
The amazing Shantavia Meet, and each week we will bring you different discussions on healing. And
yes.
We're starting on something that's very close to my heart. But before we get started, Shantavia, just introduce to this platform who you are and why you are the person to share this information.
Absolutely. My pleasure. So my name is Shantavia Gill, and I am a bachelor's degree registered nurse. I've been in the medical field for over 15 years, and in those 15 years span, I have worked in medical, surgical, long-term, oncology, hospice, renal. I've done it all. But in the past 3 years, I have become certified in herbalism, and so I've been teaching and carrying on the rest of my career with a more holistic approach. So for the next 5 weeks, we have a 5-week series where we'll be discussing different topics and different home remedies to help yourself with healing yourself and freeing yourself of signs and symptoms of certain disease processes. And today we will be discussing cancer.
Yes, that's so close to my heart.
Yes.
Again, this is the Unshakable Woman podcast. Thank you so much. We are
Thank you.
And this podcast was created 5 years ago, and for 5 years we have allowed women to come on our podcast and share just their stories of healing, their stories of testimony, their stories of triumph, and those who come on to help others heal on their journey. So speaking of healing, I shared with Shantavia that today's subject was close to my heart, which is why.
Yes.
So November 2018, I was diagnosed with cancer in 2 separate organs. I chose not to go the chemo route.
Mm-hmm.
And today I'm still cancer-free, and I'm very holistic, and I think that's what joined Shantae and I at the because I do everything natural. So when I get up, I pray, I meditate, I go outside, I sit in the sun, get my vitamin D, I walk my dog in my bare feet on my grass, I come in and I get my soursop, and I have 3 apricot seeds a day and black seed oil. So that's my basic. But the second thing the second thing I had to do, my holistic doctor, first thing he said was, you need to lose some weight.
So, Cheryl, can I ask you what you mentioned that you did apricots, and you mentioned that you took a holistic route to help your cancer. Exactly what stage were you? What stage was your cancer? How severe was your cancer before you started taking the holistic route? And what made you go the holistic route?
Well, it was just the beginning. And it was 2 very vital organs for females, right?
Yes.
And so I had been going to a holistic doctor in Southern California for years, not too big of Western doctors. And he had helped me and my children and other things that were going on in our life. So I called the doctor and said, I don't understand these lab reports, what's going on? He's like, well, you got cancer here, you got cancer here, you need to come in, we're going to start this. I'm like, oh no, we ain't doing all this.
Yes.
So, and it was my birthday too. So I was going to go to Santa Monica and just hang out and have some tacos.
Yes.
About this tomorrow. And so one of the biggest things I've learned is mindset.
Yes.
Really staying in a good, positive space.
Absolutely.
And so when I went to my holistic doctor, the very next day, I didn't even tell him what was going on, but he's really good with feeling energy. And so one of the things he said to me, besides 3 other critical things, was, you're bleeding. Can you tell me what's going on?
Wow.
And so I shared with him what the doctors had shared with me.
Yeah.
So he says it's not genetics. He said, this is caused from stress.
Yes. Stress.
And I didn't tell him that, I was just brand new on this journey, headed towards divorce. He said, this has nothing to do with genetics. And that's what I tell a lot of women now that I meet, that I coach. Stop stressing.
Yes.
It makes you sick.
Yes.
And it can cause cancer, right?
Yes, absolutely. Stress can cause cancer. Yes, it could.
Yes. So I'll wrap up my story, and I'm going to let you take over this conversation. So he shared with me, here's what we're going to do. We're going to reset the cells in your body. We're going to give it 2 months. Do not have them set on you. And so we get a regimen. Besides fasting and making sure I have water, the first thing he said was, you need to lose some weight. And I'm like, I eat good. I eat really good. I don't know why I have cancer. He's like, it's not from that. It's from the stress. Like, you do need to lose some weight.
Yes.
And so, sometimes we can stuff it in our clothes and don't realize how much weight we've gained.
Correct.
Correct. Yeah, you don't know until you see a picture.
Yes.
Oh, I do need to lose some weight. So for 2 months, I went on that journey, lost the weight. I started fasting more, started getting my body in autophagy, and that's something we can talk about later.
Yes.
And whole foods. Anything with a box, I didn't eat it.
Correct. Processed foods, yes.
I didn't eat it. I prefer to go to places more like Sprouts or Trader Joe's. The big grocery stores are just overwhelming with all that food that Europeans don't even eat or buy.
That's true.
It's like, why do we have
that is true.
Everywhere you go, the grocery stores, the gas stations, there's all this food. And so I really started looking at what I put in my mouth. And my mantra every day was, when I ate, is this healing my body or is it hurting my body?
Smart. Absolutely amazing question. Miss Cheryl Stabler, I am just so happy to have, be on your platform, the Unshakable Woman podcast. I have hundreds of people who are tuning in to my live right now, and that beautiful voice that you all are hearing is that of Cheryl Stabler. She is the founder and the CEO of the Unshakable Woman podcast, as well as Just Face TV. And she has a testimony about cancer and taking a holistic and a healing approach instead of her going to chemo and radiation. So what I want to do here is kind of talk about cancer as a whole, just the disease process first, going through the pathophysiology of exactly what cancer is. And then we're going to discuss seeing some signs and symptoms of cancer, who are more at risk, what are determining factors of cancer, and then we're going to talk about how to diagnose cancer, and then we're going to talk about holistic treatments of cancer. Everyone knows with cancer you have chemo and radiation and all those other therapies, whether you're taking chemo via IV or pill form. But here on my platform, Higher Levels with Shay, and then speaking on your platform, the Unshakable Woman podcast, we are going to talk about holistic approach and cancer. All right. So, feel free to ask me any questions you like. Okay. So what is cancer? Let's start there. So cancer is abnormal cell growth. Cancer is when your it's called deoxyribonucleic acid, also known as DNA, in your cells. So it's when your cell DNA is abnormal and it starts to replicate, and your body can't recognize it as a normal functioning entity, and so it begins to collect multiple of these little cells, and then we'll get into tumor. I'll say it like this: we have trillions of red blood cells in our bodies, and what our body does is every 30 days our cells die from either being damaged or worn out. And so every time those cells replicate, they're supposed to replicate in their normal DNA and mRNA form. Well, cancer, that's when you start having abnormal cell growth, and then it begins to replicate. Okay, so you have abnormal cells. You have two different abnormal cells. You have benign, and then you have malignant. And so benign simply means that it is capsulated. And by it being envelope capsulated, it's more of a round, smooth abnormal cell growth, and it's protected and it's prevented from spreading. It's not as it's more controlled in its replication. Now, malignant cell, which is still an abnormal cell growth, that means it is not capsulated. That means that it's open, and with that opening, that means that it can grow extremely rapid, and then as fast as it grows, the more the higher your chances are for terminal illness and death. So that's why malignant is a lot more dangerous than benign. All right. So what we're going to do is we're going to talk about not necessarily the classification of tumors, but we're going to talk about some causes, some of the risk factors of cancer. So I'm going to sit this here like this.
Yeah, let's start with risk factors.
Yes.
Especially in the United States.
Especially in the United States. So here's the thing, what I want people to know about cancer. In the past 15 years, the CDC and the World Health Organization have seen cancer grow from, I think back in 2007, initially it was like 1.5 million people were being diagnosed with cancers, and now they have over 3 million cases of cancer, like 3 million annually. So it's just annually you see cancer grow. And so this is something that's going on in the United States. And so let's talk about lung cancer. We're going to do breast cancer, we're going to do colorectal cancer, uterine cancer. So for lung cancer, some of the risk factors are heavy smoking, and that's smoking cigarettes, that's smoking any type of any substance, any type of smoking at all. We're talking about carcinogens like air pollution that causes lung cancers, and then ingesting of plastics. And you can ingest plastics in your lungs by some of the foods that we eat, and like those news of those processed foods.
Packaging, right? And
packaging, absolutely.
And putting your lunch in those plastic bins instead of glass.
Yes, BPA, the BPA bottles, all those things are the plastics in which I'm referring to, or the chemicals that can cause lung cancer. Then you have breast cancer. And breast cancer, first off, I'll tell you some of the risk factors of breast cancer that is genetic is the BRCA gene, BRCA. So what I would encourage people to do is always go get your breast tissue tested and see if you carry the BRCA gene. Because if you carry the BRCA gene in your family, then more than likely you are at a high risk of breast cancer. But for those who do not have a BRCA gene, then some of your other risk factors will be like wearing extremely tight bras. Those could be some risk of breast cancer. Processed foods is a risk of breast cancer. Alcoholism, drinking alcohol is a risk of breast cancer. Colon cancer, spicy foods, greasy foods, because you got to remember all that food is going through your digestive tract. And so when that toxin and that poison is going through your digestive tract, your lungs, your stomach, your liver, your kidney, your GI tract is made up of epithelial cells. And those epithelial cells are more prone to growing abnormally if a lot of toxins are constantly being poured onto them. So
that includes seed oils for the most part, right?
Yes, it does.
Avocado.
Correct.
Okay.
Absolutely correct. And so those are some things that can cause and lead to cancer. So you got alcohol, drugs, processed foods, poor eating habits. You got things that you're not in control of, like I said, the carcinogens in the air pollution. What about our water toxicity? Things that are in our water that you see, polluted water. Those things can cause cancer. Increased exposure to radiation. And when I say radiation, I'm not meaning the treatment of cancer's radiation. I'm more so referring to radiation such as your cell phones, the microwaves, the 5G towers. All those things can lead to cancer exposure and heighten your risk of getting developing abnormal cells. Do you have any questions about that before we move on to the next part?
Or if anyone is live with us and they have questions, feel free to chime in. Oils are big for me. I always tell people about seed oils, and it's good to clean your tires with, but that's about it.
Correct. Vegetable oil, canola oil, seed oils, all that is bad. We have a lot of comments actually in a chat. A lot of people are commenting now, and we thank y'all for your comments. We welcome you, commentators. Thank y'all for joining us on this beautiful podcast. So one of the questions we have here, I think I've already answered the question though. It says, why do we think there's an increase? And again, the increase is because of the environmental changes. The life is changing. I mean, technology has changed. We are more exposed to cell phones and more exposed to radios and radioactivities than we've ever been before in our lives. I mean, 5G towers are popping up in every single city. We don't have a lot of windmills. We used to generate our electricity through windmills, but now we're getting all this radiation from the 5G towers. And that is why I tell people, like, when you have your cell phone, always try to keep it on speaker as much as you could, instead of holding up to your body, holding up to your ear. It has gotten to the point in the medical field. Speaking of that was a great question. Speaking of that, there's now a new term in the medical field called cell phone area. So basically what that means is if you have a tumor, and I'll explain what a tumor is, but when you have a tumor and like here in your oral cavity area, your face, your jawline, or if you have it more like you're getting ovarian cancer or prostate cancer because your phone is always on your hip, they are now classifying that as cell phone area because you're always either here or your phone is always in your pocket. And so they'll say cell phone area. And so going back, what a tumor, let me tell you how miraculous the body is and how God has truly made us. I love it. Our body is so miraculous. It is a self-saving organism. What I mean by that is it is extremely intelligent and it can detect any abnormality that's going on in our bodies. And so when you have abnormal cell growth, your body instantly alerts its lymphatic system, which is your immune system, and then it'll tell your body to go and collect those abnormal cells. And so those cells are collected into what I like to classify as a trash bag. So let's think about like a trash bag. So you have all those abnormal cells going into a trash bag, is what y'all know as a tumor. And what happens is once that tumor is becoming so full of these abnormal cells, because they're not being caught in time, they wasn't detected in time or treated in time, just like when you fill your trash bag at home, it's burst.
Right.
And so when that tumor spills over, then that's when you have what is called metastasis. And metastasis is when the abnormal cells grow from one body part to the next. What I want y'all to do is Google a image of the lymphatic system, and notice how all the lymph nodes are in the areas that you're more prone to getting cancer. We have lymph nodes in our neck, we have lymph nodes in our armpits, near our breast, we have lymph nodes all in our pelvic areas, right there. We have lymph nodes everywhere where you're more prone to developing cancer, and it's because our body is so amazing. Our lymphatic system is our sewage system, so it wants to collect all of the toxins, and when it can't get to it, your body's going to send a signal to just collect it wherever it is, in like a little pocket, and that's when you have a tumor. So,
can I interject for just a second?
Absolutely. Any questions?
So you talked about the cell phones.
Yes.
Can you also touch on eating at restaurants as well?
Absolutely.
And cooking your own food at home and how much more healthier that is for you?
Okay, so I'll touch on that with two things. So restaurant food is not healthy for 3 reasons. 1, we're talking about hygiene. So we don't even know how the food is being properly prepared.
Right.
2, we don't even know what it is we're actually eating. There has been multiple studies that we think we're eating like salmon, but it's really not salmon, you know? And so you really don't know what you're even eating when you're out in the restaurants. You're just trusting that the establishment is being honest, but you truly don't know. Secondly, restaurants are designed to make money. And so when you go into a restaurant, they have 1 million with billions of people coming into their establishment throughout the day. So what you're putting in your body, you have thousands of other customers that same as that food into the body when we don't even know each other's medical history. They don't know your diagnoses. They don't know anything about you. So you want to be very careful when you go into a restaurant for those 3 reasons. For hygiene, they don't know your medical condition, so they're going to give you and prepare the food the way their chef cooks it. But at the end of the day, they don't know your blood type. They don't know what diagnosis you have. They don't know what medications you're on. They don't know anything. So you're going in there blindly trusting and you're eating this food. Another thing I want to say about eating at home, it is there's so many benefits to eating at home because you know your own food, you know your own diet, you trust your own cooking. But what I want to say about that is do more due diligence on the food that you're cooking and preparing for yourself as well. Also do your research on on how you're preparing your own food. Just like we mentioned the oils. Like it'd be best cooking like coconut oil versus you cooking in vegetable oil. You see what I mean? Or corn oil. And a lot of that stuff is petroleum jelly, and a lot of that stuff is waste that you would typically use in a car. Meanwhile, we're ingesting this in our bodies.
Yeah.
You see what I mean? So even when you're preparing your food at home, it is absolutely important for you to even do your own research on the food that you're preparing for you and your family.
Absolutely right. And,
yes.
And going into your pantries and throwing away a lot of the things that are in boxes and
yes.
truly just recognizing, does it come from the ground or is it grass fed? Those are your meals.
Yes.
Anything else is not a meal. It's engineered food.
Yes, it is.
Which does
It's 3D. It is 3D printed. It's genetically modified. The animals aren't even the real animals. I mean, it's just a lot that's truly going on. You got seedless fruits and seedless vegetables, and then even now they're making vegetables and fruits that does have seeds in it, and they're not even real seeds, so you can't even replicate it and grow your own. So I encourage everyone to really start to consider growing their own foods and doing it as quickly as possible and as fast as possible. I really do. Yeah. We have a lot of people joining in. Thank you all for joining in. We really appreciate you all being here. So for those who are just now tuning in, we are on the on our higher levels with Shay podcast has joined with the Unshakable Woman podcast with Cheryl Stabler, and she is on Just Faith TV. She is on Spotify. You guys can follow her on Instagram and follow her here on TikTok. So she has been gracious enough to invite us onto her platform, and so we are discussing cancer in addition to cancer every week for the next 4 weeks after today. We're going to be discussing the different disease processes. Like next week we'll be discussing, I'll tell y'all later. I'll tell the end we'll be discussing next week. But that one's going to be a treat. I'll make them wait. And so y'all welcome Miss Cheryl Stabler onto our platform as well, as she has graciously welcomed us onto her platform. So
yes, and welcome to my TikTok fans as well, those who are coming on. And,
yes.
And TikTok is still really new to me.
Yes.
So I am happy to be here. And this young lady sitting in front of us, this is something new for the Unshakable Woman podcast. We are now going to visual and audio.
Yes.
Audio for 5 straight years.
Yes.
So you are birthing our first video podcast. We're very grateful to have you on for 5 consecutive weeks. And when I tell you, I want you to mark your calendars and to click the reminders on the phone. We put them on Instagram and Facebook because you don't want to miss Shantae Meeks and all of the great information
that
she's bringing forward for health and healing.
Thank you.
So, give that mic back over to you. So let's continue with, we were talking about the restaurant.
Yes.
We were talking about
cancer. We talked about tumors. Yes. Yes, we talked about cancer. We talked about, just a general definition of what it is. And just keep it concise. It's just abnormal cell growth. We talked about tumors and your body collecting those abnormal cells and putting it into its own little trash bag. But what I want to, and we talked about some of the risk factors. And so now the next thing I want to talk about is some of the signs and symptoms of cancer. Some of the signs and symptoms of cancer. That's what we're going to be discussing next. So before I move forward, can you all hear Miss Cheryl just fine? Because she's tuning in with us from her podcast. Could you all hear her fine in the chat? Or should I bring her a little closer?
If not, we can upload the replay on your TikTok where they can see both of us speaking to each other.
Okay. So I'm getting a lot of yeses in the comments. They can hear you as well, Miss Cheryl. I got 1 no. So Adrian, if you could just try to turn your volume up a bit. But I got a lot of people saying yes, they could hear you. Okay. So good. Okay, you all can hear. All right. So now what we're going to talk about is the signs of cancer. And I want you all to have your papers and your pens ready because we're going to go through a plethora of different signs and symptoms, some testing and diagnostics that you can do on yourself, like self-exams as well as medical exams. And then in the end, you all know how we do it. We're going to talk about herbs, different herbs. But I'm going to go a little deeper today. I'm going to actually talk about quite a few herbs and the reason why they're good for cancer. How are they beneficial to someone who has cancer? Because I know I can just give you all herbs, but I'm going to go a little bit deeper today, okay? And I think that's how I'm going to do it moving forward, just going a little deeper. So one thing you want to write down is caution. You're going to write down the acronym CAUTION. CAUTION, okay? Now, and you're going to go down the line, CAUTION. Now, those are our acronyms.
I love it.
All right. And so, what does the C stand for? The C is change in bowel and bladder function. So, in caution, C is change in bowel and bladder function. Because your body knows that you're having these abnormalities, of course, we all know that our urination and our defecation is our body's defense mechanism in releasing toxins. That's our kidneys and our GI system, right? So when you start to notice some abnormalities in those, that is one sign of cancer. Okay, so what you should have when I talk about urine and the characteristics of urine, it should be yellow, like straw colored to clear. It shouldn't be bloody. It shouldn't be cloudy. It shouldn't be foul odorous. What you intake in is what you should be putting out. So if you see yourself consuming a lot of water, but you're not putting out a lot of your output isn't matching up, then that is a concern. With your bowel movements, you should have full soft form bowel movements. If they're like pebbles and they're hard, then that's a sign of constipation. You should have a bowel movement after every meal. And I make it a point to stress that, because a lot of people think that when you have, they'll think one bowel movement every 2 days is normal. One bowel movement every 2 days is not normal. One bowel movement a day is not normal. You should be going, every time you eat a meal, you should be having a bowel movement, okay? So if you notice some changes in your bowel movement, then that is a sign. Another sign is when you have a sore or cut that is not healing properly, all right? So the A stands for a sore or cut that is not healing properly.
Okay.
All right. The U stands for unusual bleeding or discharge. So again, we talked about your urine. It should not be bloody. Your feces should not be bloody, and you should not be able to bleed easily or bruise easily. You see what I mean?
Okay.
The T stands for thickening of like your tissues. Thickening of, like if you have lumps underneath your armpits, if you have lumps in your breast. And we're going to talk about exams, okay? We're going to we'll talk about self-health and self-lymphatic exams, and how you can massage your lymphatic system and do your own self-checks, okay? So you should not feel lumps in your pelvic area. You should not feel lumps in your rectum. You should not feel lumps in your breast, under your armpits. Your tissue itself should not have lumps. So that's the T is thickening of the tissues, okay? Now, the I is ingesting, having difficulty ingesting, and that means having difficulty swallowing. So if you're having an issue with swallowing, then that is a heavy concern, all right? You got to think about your lymphatic system, thinking about your thyroid. So if your thyroid is starting to be enlarged, if your lymph nodes are starting to be enlarged, then that means that they are they're inflamed for a reason. That means they're fighting off a very huge infection. If you notice, every time you get a cold or influenza or COVID, we're not speaking into existence, but it's out here again. So that's just a fun fact. COVID is out here again, so be careful and take precautions. But if you notice yourself getting a cold or flu and you have that sore throat and you have sore throat, that is why. With cancer, it'll be even difficult to swallow because it's a huge infection and abnormality that's going on in his body. You see what I mean? That's life-threatening, okay? So the I ingesting is for difficult swallowing. The O is obvious change in moles. Whether you are growing a mole and it came out nowhere, or whether you had a mole. Now, I do want to say this fun fact. You guys know that moles is actually called melanomas, right? They have benign melanoma, and then you have malignant melanoma. So when you have a mole, and you hear the word melanoma, that means a mole, okay? So if your mole is starting to change, that is a concern, okay? Because it means it was benign at first and now it's malignant, all right? And then the last one is a nagging cough or hoarseness. If you just always hoarse, your voice is always hoarse. Those are what I'm saying. So that is your caution, okay? So those are like the main signs and symptoms of cancer. And when I say main, I'm meaning like those early stages.
Okay.
Now, later stages is, of course, significant weight loss, unexplained weight loss. So you just keep drastically losing weight. Another significant one that's alarming is pain, when you're in constant pain. So if you start to have pain and you start to have weight loss, then that's already like a secondary sign and symptom. That means that it is progressively getting worse, and you need to go seek assistance immediately. Okay? Don't wait till you don't try to manage your pain on your own. If you know that something is going on in your body, like your menstrual cycle is more painful than it usually is, and you're bleeding more heavier than you usually is, don't try to manage it at home when you know your body. Go seek assistance. Gentlemen, if you know that during your urination and you're having issues with urinating and it's painful to urinate, or it's painful during sexual intercourse and that isn't normal for you, go seek assistance immediately. Okay? Bowel movements. If you notice your bowel movements are starting to have pain, go seek assistance. Do not try to manage this on your own, because cancer, and like I said, it is not envelope capsulated, which means that it is out of control and it can spread rapidly. So those are some things that I want you all to write down,
I love that. Caution. CAUTIO.
Yes.
I hope you guys got it. If you didn't, listen to the replay on Instagram.
That's right. So CAUTION. I told you all, have your paper and pens ready. If you did not catch it, make sure that you go to Instagram on the Unshakable Woman's Instagram page. She will have it there, and then I have it posted to my YouTube channel at a Higher Level Shade on my YouTube. Okay. So, any questions before we start getting into like diagnostic studies, or if you want, we can start. I know we're on a time frame, so we could either do one or two things. We start getting into self exams and diagnostic studies. Or we can go into like who's more prone to getting like breast cancer, colon cancer. If you want to skip over that, we just get into diagnostic studies. What do you want to do?
Well, let's get into diagnostic studies. And what I would suggest is everyone who is following me or following you to go to your profiles and schedule a consultation with you one-on-one to get more information.
Thank
this amazing woman. So we're just giving you a little recap here.
Yes.
And we're going to drive you to Shantavia's, her Instagram, her YouTube, her TikTok, and she has a link that you can click on.
Yes.
So that you can visit to have a one-on-one consultation for more information directly for you. And you can ask all the questions that you'd like to ask.
Thank you. I greatly appreciate it. So, I'll tell you like this. When you talk about diagnostic studies, let's go over self-exams. Let's go over home. Let's go over primary first, which is auto, ourself. So for everyone, let's go talk about everyone as a whole first. So for everyone, you're going to check your lymph nodes, and you have some sinuses inside of your face, and that's how you drain your sinuses. That's draining your lymph nodes, and you're checking, your temples. That's right. That's right. Like a cat eye. Yes. Good job, Cheryl. That's right. You're massaging right underneath your jawline, your jawbone, and just kind of feeling to make sure that everything is intact. You feel it underneath your armpits, checking. This is just everybody. This is just general self-exams, okay? Your pelvic area. Your inner thigh area, you are checking those areas. It should not be sore. You should not be able to feel a lump, okay? Now, women, when you are doing your breast exams, you should be doing your breast exams monthly after you begin your menstrual cycle. So after you begin your menstrual cycle, so yes, young girls, teenagers, adults, every single month you get your menstrual cycle, or right around the time your menstrual cycle, you should be doing your exams. Now, FYI, I do mine every day. That's just the nurse in me. But you more so do it during your menstrual cycle, because that's when your hormone levels are more elevated, and so you have a better chance of detecting it. Okay, so you're going. The best way to do it. Great question. Is you lying flat. And I always say after a shower. And the reason why I say after a shower is because with that warm shower, you're relaxing the breast tissue. You're relaxing the muscle. And so it's not as tense from being in a bra all day or moving around all day. So I always say after a shower. And then you want to lay flat. You lay flat because you give your breast tissue some time to spread. So when you laying flat, your breast tissue is spreading. So while you're laying flat, what you're gonna do is you're gonna start at the armpit first, like your outer breast area first, quadrant first, and then in a circular motion, you take your 2 fingers, and then you're going to be massaging all around your entire breast, really pressing down on it, right? So that you can really feel if there's a lump or not. And you're gonna feel your ducts, and you're gonna feel normal breast tissue. That is absolutely different from an abnormal lump, okay? And so you're gonna go around, and then always until you get to your areola, and then you're gonna go around to your nipple. Once you get to your nipple, you're going to squeeze your nipple. There should be no discharge. There should be no pain.
Okay.
We do have a comment here. She said, I wish I would have known this information. I now have stage 3 pancreatic cancer. For the commenter, we are going to be discussing some herbals, okay? So we are definitely going to be discussing some remedies for you, okay?
And
yes. Contact information. Yes, and contact information. So what you're going to do is you're going to squeeze your breast, and you should not have any discharge. There should be no odor coming from your breast, and there should be no pain. Now, let's say you do have find a lump. Again, now you have your benign lumps, and then you have your malignant lumps, okay? Now, for the benign, again, they are capsulated. Remember, they're in an envelope. So you should be able to, okay, good. You should be able to feel the lump, and it should feel real smooth. And it should be movable. It should be a little bit mobile. You should be able to wiggle it. And it hurts. A malignant lump is stiff. It's hard. It does not hurt. And it is so rigid. It has an irregular border. Either way, if you detect a lump, go get tested. Excuse me. For the men, for your testicular exams, you're going to do testicular exams. The same thing. Every time you're in a shower, what you're going to do is you are going to take your fingers, like the 2 fingers here and your thumb, and then you are going to massage. You're going to massage a testicle, or scrotum, I should say, because the testicle is the bag of the scrotum is housed in the scrotum. So you are going to palpate or touch and squeeze each scrotum one at a time, and just kind of feel through your scrotum one at a time. If you feel a lump, the same thing. If it's circular and round, or if it's benign, if it's more rigid and irregular, then I don't want to diagnose, but no matter what, if you find a lump, go seek assistance, okay? Now, what they're going to do is, after you've done your self-exams, they have other diagnostic studies like biopsy. And that's where they aspirate or they get a small needle. And of course, they'll do like local anesthesia. And then they're going to take a small needle to aspirate, meaning they're taking some of the tissue, and then they're going to test it to see if it's benign or malignant. And if it comes back benign, then they'll give you some medicine, some things, and some instructions. If it comes back malignant, then you're going to do further testing. Women, you have your mammograms, and we have colonoscopies, okay, for all people. And men, you have your prostate exams, right? Now, the next thing is CT scans. CT scan, so you can get an image, a visual of the lump, the tumor, whatever it is, or the mass. They'll get an image. Then the next thing is the MRI. And the MRI is a more adequate test. It's more concrete. It's more definitive, because while the CT is scanning, and MRI stands for magnetic resonance imaging. So it's magnifying and being able to go through the tissue to really get an in-depth and a better accurate science of the tumor and exactly what it is and what stage that it's in. All right. So you always want to make sure you get your testing. It's very important for women to get their pap smears. Okay, it's very important for men to get your prostate exams. I know a lot of men, it's not comfortable for them, but it is extremely important for men to get the prostate exams, and everyone to get their colon exams, and women, again, pap smears. When should women get their pap smears done? Women, you should get a pap smear done after the age of 21 or 3 years after you start to have sexual intercourse. And then you're going to get your pap smear done annually or every 2 years, depending on, well, if it's abnormal, then you'll get it done annually. But if you are having 3 consecutively normal pap smears those first 3 years, then they'll tell you to come in every 2 years. But of course, you notice anything abnormal, go and get tested. I don't care if you just got one 6 months ago. Go and get another pap smear.
Right. Well, I love all this information.
Yes.
Again, just to recap, everyone who's just joining us.
Yes.
Hello, I'm Vicky Long Beach in Los Angeles, logging in. This is my friend Shantavia. She is an expert in the medical field, and for 5 weeks, we are talking different areas of healing in the body, and today is cancer. And so we are going to upload this file onto Instagram. It's going to be on our YouTube. We're going to get it on TikTok. It's going to be everywhere, including Facebook.
Yes.
So you can watch the replay from the very beginning, so you don't miss anything. So I want to thank you for coming on the show today.
Yes.
I look forward to the next 4 weeks with you. You have so much information.
Thank you. Thank you. This is my passion. This is my purpose. This is my mission. And I love sharing this information with everyone. So thank you for having me here.
All right. Well, thank you to all the listeners who tuned in on both sides. Can you shout out loud where my followers can find you? Yes. Did you want to, has it been 30 minutes yet? Oh, I think it has. Oh, okay. Well, stay tuned in to my higher level shave, because I'll be going over some herbs. I wanted to go over some herbs and some home remedies. But you can find me at Higher Level Shade on TikTok. I am currently on my live now, and on there I'll be going over some herbs and some remedies. And you can find me on YouTube at Higher Levels with Shay, where I post these videos if you don't catch the live. You can also book a consultation at www.yafasakoor.com. I thank you. Now, and here for my followers, we have Miss Cheryl here, Cheryl Stabler. Again, she is an amazing God-based, faithful woman of God. I mean, just beautiful soul inside and out. And she is the CEO and founder of Just Space TV. You can go and subscribe there and find that on the Viry Network. And she also has an Unshakable Woman podcast, and that is on YouTube, that is on TikTok, that is on Instagram, that is on Facebook. So you can go and follow her platforms everywhere. Spotify.
Yes, and make sure you subscribe on Spotify.
Yes, thank you so much for
You
coming
are
on
welcome.
today. Much appreciated for everyone. Tune in, follow us on Instagram and on TikTok, particularly so you can click that little reminder bell so you won't forget next Friday's show. And let's give them a little teaser for next Friday.
So next Friday, guys, now this is the beauty. So next Friday, we'll be going live at 5 p.m. With the Unshakable Woman podcast, as well as on Higher Levels with Shay. And we are going to be talking about our babies, our loves, when it comes to autism, ADHD, and ADD, and behavioral health issues and developmental delay issues. We're going to be talking about the causes of autism and developmental delays, and talking about holistic and herbal remedies to decrease and eliminate the signs and symptoms of those diagnoses.
Yes. We look forward to having you. Thank you again to everyone who joined us today. We know you could be tuned in anywhere else. We're so grateful that you had us here. So thank you again to our special host.
Thank you for having me.
And may you all be blessed from the information that you received today. Until next week, continue to live unshakable. And we're very grateful. Have a good evening.
Thank you. Thank you
so much.
God bless you.
God bless.
All right, guys. Thank y'all for staying with me. So I was invited on a podcast. That was Dr. Cheryl Stabler. So I was invited to be on her podcast. And so, here on my platform, I go live 3 times a week. So Friday is actually a special day. I'm typically going live on Tuesdays, Saturdays, and Sundays. In which this past Tuesday we talked about diabetes, and then we talked about autoimmune disease autoimmune disease a couple days prior to that. And so this Sunday I'll be going live talking about the blood. We'll be talking about different blood types: A, AB, B, O, sickle cell disease. We're talking about all types of blood. So make sure y'all are following. Make sure y'all are liking and sharing, because I do appreciate having y'all here on the platform. So on Fridays, which I'm typically off on Fridays, but they're beautiful soul asked me if I would join her podcast on Fridays. And so, of course, I told her that I would do her podcast for the next 5 weeks. So on Fridays, we will be going live. And next Friday will be about ADHD, autism, and childhood diseases, developmental delays. But right now, for those who are just tuning in, we are talking about cancer. And so if you just now tuning in, we talked about the pathophysiology of cancer, tumors, some causes of cancer, signs and symptoms of cancer, some risk factors of cancer, some diagnostic studies, and self-health exams. Now, what I want to get into is some herbal treatments of cancer, okay? So that's what we're going to get into. We're going to get into some herbs. Before that, I've seen a plethora of comments. And so if you all have any comments, please comment. If you have any testimonies, because that's one thing I want to start doing is if you all have had any disease process and you can attest to taking the holistic route and seeing that you have been cured or you have been free of signs and symptoms of those disease processes, I would love to have you request to come on, and I would love to have you actually in. Raquel, I love you. And then for the person who says it's pancreatic cancer, we will be discussing some herbs and remedies. I don't know if you're still on, but we're going to be discussing some herbs right now about different forms of cancer, okay? And don't forget that caution that I was telling y'all about, CAUTION. All right? So do we have any questions before we move on with cancer in these herbs? I want to make sure that I give you all an opportunity. Any questions? Any comments? Okay, good. All right, good. You say you're still on. All right, perfect. And when you said you wish you would have known, this is the reason why I'm starting to do this. I mean, I still work in the medical field. I'm never going to leave it. And this is why I do it, because I hear a lot of patients saying, had I known this, or if I would have known that, or if the doctors were more clear about this or that, then it makes me really sad, because I wonder what kind of conversations are you having in the office with those physicians to where you don't have this information. And so that's why I'm sharing it, like I said. So thank you all for being on. All right, and you all get your pens and your papers ready, okay? Get your pens and paper ready, okay? So we're gonna give y'all a few herbs about cancer prevention. Oh, somebody's requesting to come on.
Oh Lord, I didn't mean to do that.
Okay. All right. I'll drop you down. Okay. All right, so here are some herbs that will help you to prevent cancer, okay? So you have your ashwagandha. That's ASHWAGANDA. Ashwagandha. I really need to get a moderator to be writing this stuff down and putting it in the comments, but ashwagandha. Bilberry. Apricot seeds. Apricots and apricot seeds are not only notorious for eliminating cancers and abnormal cells, but they also prevent. So when I say apricot seeds, I mean you grinding them, putting them in a smoothie, grinding them, taking them in a capsule. I don't care how you decide to ingest it, but the apricot seeds, okay? Then you have cat's claw, calendula. 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 And again, full disclosure, make sure you all are doing your due diligence on these herbs, because again, I don't know anybody's medical background, your allergies. Some of these herbs help thin the blood. So if you have a blood thinning issue, then make sure you don't take that herb where you're further causing yourself any damage. So do your due diligence on these herbs. I will be talking about a few of these herbs and just talking about some of the great benefits of them and the reason why they're really good for cancer, like reishi mushrooms and stuff like that, okay? So I will be doing a little bit of that talking, okay? Now, we have rosemary, turmeric, self-seal, SEAL, self-seal. Share the laugh, like the laugh, greater burdock. And greater burdock, actually a lot of these herbs can be found in your backyard. They can be found in your backyard. Just stop spraying those pesticides on them and those chemicals on them, and you will have them, okay? Cattails. That is another one. Dill. Devil's Club. Write that one down. Write down Devil's Club. Licorice root. And again, make sure that you thank you for the hearts. Thank you, thank you, thank you, thank you. I really appreciate it. Y'all double tap the screen if y'all are learning anything. Double tap the screen if you are learning anything. Okay, I see the hearts. I see the hearts. And thank you for sharing the live Groove for Life. I really appreciate you sharing this live to others. Thank you. You have chaga, choke cherry. And I need y'all to write these down, because again, we'll go a few of these herbs as to why they are beneficial when it comes to cancer and why they are helpful to cancer. Now, those herbs that I gave y'all, not only do they help with cancer, but they also help to prevent cancer, okay? Now we got skin cancer. So skin disease cancers, I'm gonna give y'all those herbs. And then we get to the other herbs where it's like all cancers, okay? Like it helps with all cancers. So for the skin cancer, you have ash, A-S-H, ash. Wormwood. Wormwood is amazing for not only just cancer, but detoxing the digestive system. You want to clean your gut? Get you some wormwood. Get you some wormwood. Lion's mane mushrooms. Those are mushrooms. You can eat them. You can put them in a capsule. You can purchase them in a capsule. Lion's mane mushroom. Milk thistle. Milk thistle. Red clover. So milk thistle, red clover. Thank y'all for the hearts and thank y'all for sharing the live. Sheep sorrel, S-O-R-R-E-L. And then your turkey tail mushrooms, and then we'll get into why, okay? Now, this next batch of herbs, this is for all herbs. I mean, not all herbs, all cancers. Do I have any questions so far? Or are you guys okay? Are you guys learning? Are you guys okay? Or do I have any questions? Any questions in the chat? All right. So, tumors, cabbage. Thank you. Thank you. Oh, good. There you go. So cabbage. She says, well, someone says herbs for the colon cancer. So these next list of herbs you're going to be able to get. This is for cancer as a whole. So for ma'am who just asked that question, thank you for commenting. These herbs I'm listing now, this next set of herbs is for all forms of cancer. Okay? Thank you for the gifts. Thank you. I appreciate the gift. Thank y'all for sharing this live. So we have cabbage. Thank you. We have chaga. That's CHAGA. And again, I want you all to do your due diligence and make sure that you are educating yourselves on these herbs, because I do not know what medications you're on. I do not know your medical diagnosis. I do not know your allergies. Some of these herbs are not suitable for pregnant women or women who are trying to become pregnant. So please make sure that you all are doing your due diligence and make sure that you are researching these herbs, okay? And then find the one that best suits your body and your holistic need, okay? Cranberries. Again, apricots and the apricot seeds. I cannot stress that enough. Mullein. MULLEIN, and specifically mullein is great for lung cancer. Okay? For Jane, who asked about lowering your blood pressure, please go to my YouTube channel. We actually covered the cardiovascular system about blood pressures and those herbs. You can find that recorded on my YouTube channel at Higher Levels with Shay. So we discussed blood pressure, we discussed autoimmune diseases, we discussed male and female reproductive issues. We discussed HIV, herpes, we discussed kidney disease, we discussed liver, we discussed a lot. We discussed diabetes, we discussed dementia. You can find those videos on my YouTube channel. Subscribe to At Higher Levels with Shay. And you can also follow me here on this platform, because again, like I said, Sunday, we will be going over the blood types and the diets of the blood types. Blood type A, blood type B, blood type A, B, O, understanding the differences in what those mean, your program between positive and negative blood program, and talking about pregnancies if you are negative, you negative blood type, and talking about sickle cell, like different blood diseases and stuff like that, and stem cells, okay? So we will be doing blood on Sundays, all right? So thank y'all for the follows, thank y'all for the hearts, and thank y'all for sharing this live, okay? Now, back to the herbs. Parsley, oregano, turmeric. I typically go live around at 4 p.m. Central Standard Time. 4 p.m. Central Standard Time. So Sunday, I'll be going live at 4 p.m. Central Standard Time. I know we usually on your guys on Saturdays. This Saturday, I have a full schedule Saturday, so I will not be here on time this Saturday, which is why we will just pick up on Sunday. But we had a bonus show today, because I'm not here on Friday, so we had a bonus show today. So that makes up for my tomorrow. So then you have quacking aspen. That's QUAKING aspen, ASPEN. Reishi mushrooms, turkey tail mushrooms, self-sealed red root. Red root and blood root are amazing for detoxing the blood as a whole. Thank you for the gifts. Oh man, that's my Miss Beast. Hey, you guys have to follow Miss Beast Mode. Miss Beast Mode, I'm gonna tell y'all right now, y'all need to follow Miss Beast Mode. Anybody who's on here right now, she's absolutely amazing at what she does. She's very genuine, authentic, and when I tell you, watching her lives, you feel a sense of love, happiness. She hits some tough topics, but it's all out of love, all out of love. So follow Miss Beast Mode. Thank you. Yeah, so red root and blood root are really good for detoxing the body and the blood as a whole. You want to just detox your body as you're doing your detoxing juice, drinking your fruits, your vegetables. And I do want to make sure I say this to you all right now. when you're on these herbs, make sure this is a lifestyle change. This is not just for you to turn around and then just start taking herbs but still live your typical lifestyle. You have to make the lifestyle change. Thank you. Oh, I love her. You gotta make the lifestyle change. That lifestyle change entails no processed foods, no drugs, no alcohol. Stay away from meats. Stay away from fried foods. If you have rectal and pancreatic cancer, stay away from spicy foods. You can eat your fruits, eat your vegetables, eat your herbs, okay? Now, I know it's going to be a huge transition to just abruptly just stop all of a sudden. However, you could just start one at a time making the adjustment. You know what I mean? One day at a time making the adjustments. But as you're on these herbs, you're trying to heal yourself of cancer, I can't say that. You're trying to relieve yourself of signs and symptoms of cancer and kill off the cancer cells. Then I would say make a lifestyle change. Another thing you need to do is sun. Vitamin D is extremely important. Hydration, particularly coconut water or spring water, is extremely important. And I mentioned coconut water and spring water first because coconut water is extremely electric. It's extremely electric, and it fires our protons, our neutrons, and our electrons in our body. So it just helps strengthens it. It strengthens our neurovascular system. When I say spring water is not only more compatible with our blood, but it's the most natural. A lot of people ask about the alkaline water. Alkaline water is mineral based. It is man-made. They put more minerals in it and put the alkaline in it versus you just going on an alkaline diet and ridding your body of acids. Okay? So spring water, coconut water, getting as much sunlight as you could. For those who do not have a sensitivity or skin issues to sun, get out there as much as you could, at least 2 hours a day. For those of you who are hypersensitive to sun, then go out there at dusk and dawn. All right? The 2 herbs to clean the blood was red root, blood root, like the color red, and roots, and then blood root. Those are the 2 herbs that'll help you detox your blood. All right. So I hope y'all got those down. Don't forget to drink y'all cranberries. Okay. So let's talk about and chaga. I cannot stress enough about chaga. That's CHAGA. All right. Now, chaga helps to prevent cancer and it treats cancer as well. And when I say cancer, chaga is really essential. That is a mushroom, and that is really beneficial for Hodgkin's and non-Hodgkin's lymphoma. Now, non-Hodgkin's lymphoma is a very, 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 very aggressive cancer. So chaga, to be exact, you're talking about what's going to do what exactly? Chaga, to be exact, is going to really reverse the signs and symptoms of Hodgkin's and non-Hodgkin's lymphoma, and then it also destroys and slows down the production of abnormal cell growth. So it destroys the abnormal cells, and it also slows down abnormal cell growth. The reason why I would highly recommend taking a holistic way initially first is because of radiation and chemotherapy. It cannot decipher good cell versus bad cell. So while you're receiving radiation and chemotherapy, and I'm not speaking against it, I just want you all to be able to make a well-informed decision. And so with that chemo and radiation, it doesn't know how to decipher between good and bad, so it's going to destroy both the good and the bad cells. Someone asked a great question when we covered cancer a couple weeks ago, and they asked about their hair loss, because they kill off the weakest cells first. And well, I won't say the weakest, the cells that replicate the fastest, and the cells that replicate the fastest is your hair cells. Okay, so that's why the hair cells are the first to you start seeing your hair loss, because they replicate the fastest. Sasha, when you ask where can you vet, what do you mean? Could you clarify that question for me in the comments? So, or are you asking about the herb? I said chaga mushroom, CHAGA. That is the mushroom, and like I said, that slows down and stop cancerous tissue growth, and it stops it from metastasis to other parts of the body, and specifically Hodgkin's and non-Hodgkin's. So I highly recommend you guys to do your research and get in this herb. Okay, it kills existing cells, and it also prevents the reproduction of abnormal cell growth. Any questions in the comments? Do I have any questions? Or could I continue? Because I want to get into some more of these herbs that I want to kind of go into details with you all about, and the importance of why you should get it. All right, if we don't have any questions, we're going to go on to lion's mane mushrooms. Lion's mane. Okay, oh good. So what's a good vocal cord cancer? So you're talking about throat cancer, you're talking about your like esophageal cancer. So we're talking about esophageal cancer, and again with esophageal cancer, that is epithelial cells. And with esophageal cancer, I told you for one thing for sure is mullein, mullein. That helps with all kinds of respiratory issues, from bronchitis to asthma to just allergies, cancer. So mullein, that is a plant. It can grow in your backyard. I told y'all to get that Plant Net app, and make sure y'all are researching these plants before you go and start spraying it with those chemicals and destroying those plants and having that pretty green lawn. You can be destroying medicinal herbs that can save your life. So download that Plant Net app, and then make sure that you're doing your due diligence. Okay? You can find chaga herbs at like your local not your local farmers market, but like your local herbal store. So Google a herbal store that's near you. Google a grocery store near you. I don't know where you live, what city, what state, but Google chaga mushrooms and like near me, and then see where you have. I told you all about the website already, www.yafaSHAKOOR. There is a malignant tea on the site, and in that malignant tea, it contains multiple different herbs, and you can enjoy the tea hot or cold. Hot or cold. So you go to their website and then Google malignant, look up the benefits of the malignant tea. That's what it's called on the website. And then you'll see those benefits of that tea. So it's www.yafaSHAKOOR.com. Yes, yafaSHAKOOR.com. Book a consultation. Take a look at the teas. They actually help. And in addition to the tea, I would highly recommend the GI Gene juice, because it helps to detox. So not only are you slowing down the production of cancer cells and ridding your body of cancer cells, you also will be detoxing as well. Again, during this cleanse, please be conscious enough to make a lifestyle change. No smoking, no drinking, alcohol, no bad foods, okay? 3. I would recommend 3 a day. 3 a day. Now that's dependent on the severity of your like what stage your cancer is. And I'm not putting that on you. I'm just speaking to just in general. That depends on what stage your cancer it is, and that depends on if it's metastasized or not. Obviously, if it's more aggressive, I will do more than 3 a day. But at least 3. Breakfast, lunch, and dinner. At least 3. All right. So let's get back into the. Is that another question? I'm sorry. Could someone put the site in the comments for me? I need a moderator. I'm trying to find a moderator to be able to do, be able to write these comments, and I'll be able to pin it. But it is www. Thank you, Sasha. Okay, so moving forward, I will send you a request to be a moderator. I would love that. So it is www. So Shay. Oh, did I say that right? That's so French. I like it. All right, so Shay. So it is www. www.yafashakoor.com. Okay? So, lion's mane mushrooms help to prevent lung cancer, breast cancer, prostate cancer, esophageal cancer, liver cancer, leukemia, cervical cancer. I mean, this thing just does a lot. It stimulates the immune system, and when it stimulates the immune system, it makes it more stronger, and then the immune system fight off cancer cells and cancer cell growth a lot more. Reishi mushrooms. I'll tell you about reishi mushrooms. Not only does reishi mushrooms, and that's R-E-I-S-H-I. Not only does reishi mushrooms destroy cancer, they also slow down the blood flow and prevents new blood arteries from growing on the tumor. Because you got to think about it, as a tumor is growing, there are blood vessels surrounding the tumor that's supplying the tumor. Okay? And so what reishi mushrooms do is it not only prohibits the growth and development of the vessels, but it also destroys the vessels that are already there. And so basically what that means is if a tumor is formed and if a tumor is there, what it is doing now is it's cutting off its eating supply. It's cutting off its nutritional supply. So eventually without nutrition, it's going to be destroyed. And then you're going to see less and less signs and symptoms of cancer. The website was www.y as in yo-yo, A, F as in Frank, A, the letter S as in Sam, H as in horse, A, KOOR.com. YAFAShakoor.com. And again, if you all have any testimonies where you want to join and request in, I would love to add you on if you have a testimony on your cancer journey and how you took the holistic approach, the holistic route, and what benefits or what lifestyle changes did you see, or positive changes did you notice and making that transition. So that is a great question. Did you all get the website down? All right, Reggie, I'll see you on Sunday. Thank you for tuning in. All right, so I just want to just give y'all a few of those herbs, and I just want to just kind of break it down to you a few of these herbs and the reason why they're really beneficial to cancer, because I think that's really, really, really important for you all to know. So I'll give it to you sometimes, but then I really want to just go through as to why specifically it helps you with the cancer production. You said, okay, good. You have the website down. All right. YAFASHAKOOR.com. And like I said, you can enjoy the tea, hot or cold, but definitely those apricot seeds as well. Now, I did mention turmeric. And you know, turmeric is the same thing as curcumin. Pretty much, they both like the same thing. And so they also help with the cancer cell growth and the tumor growth with preventing it from growing. So I did mention that, and you can find turmeric in your local grocery store. Actually, a lot of these herbs are spices like fennel, like turmeric, curcumin. Those are actually spices. You can find those in your local grocery store. So do your research on these herbs and make the lifestyle changes. Be mindful of your cell phone use. Be mindful of your exposure to your cell phones, exposure to microwaves. Because like I said, and why does microwave and radiation causes, how does microwaves and radiation cell phones cause cancer? Well, our cells in our body is made up of over 95% of water. And so you got to think about when you are boiling your food in a microwave. And what happens with radiation is it's actually cooking the water molecules in the food. It's not necessarily cooking the food, it's cooking the water molecules in the food. And the water molecules are heating up, which is cooking the food. You see what I'm saying? And so you have water molecules in your body, in your cells. And so if radiation is here and you're in a phone a lot, or radiation is in your pelvic area, know that you are boiling the water molecules that's in your blood cells. The more exposure you have to those, then that's how the abnormal cell growth begins to form. And so I think in my last I did cancer 2 weeks ago, somebody asked, like, how does the microwave radiation cause it? And I thought that was a great question. And so I just want to make sure I drop it off to you all as to how radiation and cell phones can cause cancer, like why and how. Because it's boiling the water in your body. Okay? Any questions? We went over cancer. For those who just now tuning in, we went over cancer. We went over how to do self-health exams, went over herbs and remedies, lifestyle changes, websites, consultations. We went over a lot here. So I just want you all to really just tap into, who God has called you all here to be. I want y'all to just do the work on yourselves and heal yourselves holistically, do the detoxing, do the cleansing, because we all here for a purpose. God has us all here for a purpose. And I want y'all here to do it. Miss Sunshine, well, good question. You didn't miss it. Because if you wasn't here for the live, I posted on my YouTube channel. Follow my YouTube at Higher Levels with Shay. Thank you. Higher Levels with Shay. And you can find I'm going to post this video to my YouTube tomorrow. I have to download it from here, and then I post it to my YouTube. So go to Higher Levels with Shay, okay? Somebody said, I want to go back up to the comments, because when I was telling y'all to do y'all detoxing, I was getting a lot of comments. Hello, Sunshine. She says, what about if you use your speakerphone instead? Perfect. So you missed that part. That's what we were discussing. We were saying that if you're going to bring your cell phones, then make sure you use it on speaker. Answer it on speaker. Don't answer it with the AirPod in your ear all the time, because even now people are starting to get little tumors in their ears. So the AirPods all day, the cell phones up to your ear, put it on speaker as much as you could. Keep it off your body as much as you could. Microwaves, we all know how to stand 10 feet when the microwave is going off, and try to eliminate your amount of microwave use. Like, if you can avoid using microwave as much as possible, I would highly encourage you to do so. Now, we can't do anything about the 5G towers outside in the world, or the air pollution in the world, or the toxins in our water. But what we could do is make sure that we detoxing weekly. What we could do is make sure that we're being more mindful and conscious what we put in our bodies. You see what I mean? So just be mindful of that. We went over the signs and symptoms of cancer. We went over the characteristics of cancer. You guys remember caution. CAUTION. All right? So remember that acronym. All right? I had stage 4 colon cancer discovered during annual colonoscopy, just released from 6-month check. So are you saying you're in remission, Miss Valerie? Congratulations, God, that is amazing. So you had stage 4 cancer in 2017, and now you've been released 6 months later, so that means you're in remission. And God is good. God is good. I'm so happy for you. Congratulations. Can long-term exposure as an MRI tech, and yes, it could. Let me finish that question. Can long-term exposure as an MRI tech impact your health? Yes. That is why when you are getting a CT done, an X-ray, well, not a CT, but if you're getting a MRI done or an X-ray done, they put what is called a lead shield over you. They tell you a lead shield, and that's like a protective apron, and it's really heavy. That they put on you, and that's because it's protecting the magnetic waves and radioactive waves from hitting your cells. But I don't know how it is in every hospital, but the ones that I worked at, it's literally like an apron. It doesn't protect your arm or your ankles or your face. So, I mean, you're still being exposed. It's just eliminating the amount of exposure. So be very mindful of that. Be very mindful of that. Let me see. She says your YouTube handle is not connected to your bio. When I tried to do it, it told me that it was too large. And so that's why I just put in my bio, I put the letter YT, which is short for YouTube. And then I put higher levels with Shay. So that way, if you go to my, go to YouTube and type in higher levels with Shay, my page will pop up. So I wasn't able to put the link in there as well because the link was too large. But you can go to YouTube and then just research higher levels with Shay. Thank you all for the hearts. That lets me know y'all learned something today. When I see hearts pop up and shares and gives, that means y'all are learning something. And that just really encourages me to just keep coming back. So I highly appreciate it. What about an air fryer? Air fryer is not as dangerous as microwave, but it's still radioactive, so it still has some danger. And I'll tell you it's the same thing, take caution. To be quite frank with you, any form of technology, I will tell you to take caution. Any form of technology, I would say take caution. You used to have old firewood stoves, firewood, you know what I'm saying? And over time, you know, life evolved, and I just say with any type of technology, just move with caution, okay? Thank you, Valerie. She says, I need to eat and exercise more. I will follow you on High Level with Shay. Please follow me on here. Follow me on High Level with Shay. I go live 3 times a week. I am a 15-year in the medical field. I'm a bachelor's degree registered nurse, 3 years certified herbalist. And so I'm talking about what I know, not what I've read somewhere. And you don't have to go to school to get this knowledge. Just come here. I'm giving it away for free because knowledge is in us knowing, and life and longevity and healing is in us knowing and having being able to have a better understanding of what is going through in layman's terms. We shouldn't have to use big medical jargon just to get a simplistic understanding. So I'm breaking this stuff down to you in layman's terms so you can just teach your children and your grandchildren. And so that these disease processes that we talk today, we shouldn't be talking about it 20 years from now, 30 years from now, because by that point, we should have adapted and applied this knowledge and been able to pass this on to the next generation behind us. You see what I'm saying? You detoxing by herbs, you detoxing by ridding yourself of the red meats, the fried foods, meats in general, fried foods, artificial sugars, artificial drinks, just drinking water, in your fruits and vegetables, smoothies, juicing, whatever you gotta do to eliminate your body of your usual eating habits. No fast food restaurant. No processed foods like boxed macaroni and cheese, noodles, and canned raviolis. None of that. None of that. That's how you definitely, when I say detox yourself. Detox yourself of all of the toxins, all of this poison. It's not even real food. Miss Pansy or Mr. Pansy. I don't know if you're a man or a boy or a woman, but I'm reading your comment about your stage 4 pancreas. I hope you were here when we gave away those herbs, and I hope that you are able to do the detox as well as do your research on the herb that will best fit you, and then you try that holistic approach. In addition to that, doing these lifestyle changes with getting as much sun as your body will allow you to get. Grounding, going outside, putting your feet in the grass. What else is there? Elimination of technology, bad foods, more sun, more fruits, more vegetables, more water, and just more mobility. I don't care if it's walking, I don't care if it's swimming, just doing something more, being more active. Being more active. And so I encourage you to do so. If you did miss our herbs, go follow my YouTube channel at Higher Levels with Shay, and that is where you will find this recording, okay? Melissa, the same thing to you as well, my dear. Yes, I am. I'll be on Sunday at 4 p.m. 4 p.m. Central Standard Time. Eugenia, you are so welcome. She said, thank you so much for sharing with a lot of hearts and hearts and hearts. And I love seeing the hearts. Thank you. You're welcome, Queen Maya. Valerie, I don't know what that is, Eastern Standard Time, but it's 4 p.m. Central Standard Time. You are so welcome. To God be the glory. Are apricot seeds sweet? No, they're not. Thank you. Thank you. They're not sweet, but they, that's what I was saying. You can like take it in a capsule. You can add it to your foods. You can add it to your shakes. So I feel like if you're going to do a juicing or you're going to do a smoothie anyway, just grind up your apricot seeds and mix it in your shake. And then just consume it that way. It's really good when you can't taste the bitterness. And like I said, 3 times a day. What can help the esophagus? We did go over esophageal cancer. We went over those herbs, but I highly encourage mullein, Mullein, chaga, CHAGA. We talked about reishi, RIESHI. So we went over a lot of herbs, but I will be posting this to my YouTube channel. I don't know how many people eat boxed macaroni and cheese, cans of raviolis and things. I hate those. But listen, you do. Now I'm just naming some, but I mean any box, whatever. Frozen food, processed foods. You see what I mean? Canned tuna, canned Viennas, whatever, canned soups. Just all those foods that has all those additives and those preservatives in it, and the man-made chemicals in it. Now, of course, we're not going to be able to change everybody. Somebody's going to still, eat what they eat. And this isn't to, pressure anyone to make a lifestyle change. This is just a well-known facts. And then you pass it down to your children and your children. So if you're not willing to make the change, then at least give them the upper hand and give them the leverage of having a chance in life without having hypertension, diabetes, cancer, because they don't have this information, they have this knowledge. So they already have a leg up. Somebody else said, yes, that is how I live. My daughter is diagnosed with alveolar rhabdomyosarcoma. Yeah. Yep. So that's a form of lung cancer. And so please share this lab with your daughter. Please show your daughter this lab. And again, it'll be on my YouTube channel at Higher Levels with Shay, because I don't know the stage, but she can make some lifestyle changes that will help her to destroy those cancer cells 100%. 100%. What can I use for an enlarged liver? I think we already did a video on liver. That's on my YouTube channel. Did we do liver disease or no? I'm not sure. I think we go to my YouTube channel and see. But if not, then just DM me and then I'll do liver next. I could have sworn I did liver already, but if I didn't, then I'll do liver next. Not this Sunday. This Sunday is going to be about the blood types. We're doing a blood type this Sunday. Yes. So for the person who asked about avocado pits, she says, somebody said, greetings, your aura depicts that you are a living testimony. God bless you. Continue being in health. And thank you. Yes, saved, sanctified, filled with the Holy Ghost, then baptized and born again. I do prayers every Friday morning. I'm going to be going to our prayers every Friday morning. When you said cranberries, did you mean juice or the berries? I mean both, but really the berry itself. The berry itself. And the reason why I prefer to consume fruits, vegetables, and herbs, well, not herbs in its rarest form, unless it's like you could turn into a spice, or like dandelion leaves. You could eat that in its rarest form, But The reason why I prefer fruits and berries in its natural form is because so that your body, when it's ingesting it, it's going through its natural state. So like if you're eating it, then it automatically kicks on your salivary glands in your mouth, and it tells your body to produce salivary glands. And then what the salivary glands do is it produces that secretions in your mouth, and that helps your body to absorb whatever nutrients and minerals that you're needing to get inside of it. Whereas juicing is, this is what I'll say for two things. One, if you're diabetic, then I would not encourage you to juice, because juicing also juicing increases the blood sugar. So if you're diabetic, I don't recommend you to juice. Two, I like juicing, but if you ask me what's the best form is its rawest form. But you can also consume it in a juice. But when I said cherries, I was meaning actually like eating like big bags of cherries. Just go cherry crazy, you know? Let's go crazy. I will see you Sunday at 4 p.m. Yes, see you Sunday. Somebody said, great job. All right. Yes. This is my ministry. This is my purpose. This is my glory. 15 years in the medical field, and I'm still growing strong. I still have other businesses pertaining to the medical field. I have my school, you know, where we teach CNAs and Q&As, and that's what it was for me. It was so Shay, you were amazing. You were amazing. Thank you. I really appreciate it. I look forward to working with you moving forward. And so, yeah, so I have my school, and for me, it wasn't enough. With my students, I was going over things with them when we talking about nutrition in class, or with our patient care and different disease process. And they're like, well, why are we learning so much from pharmacology? Why are we learning about the holistic approach? This is so much more. And I was just like, you know what? You're right. And so I was obedient. I was told to start going live. I was told to start just giving this information out for free. And so that's what I'm doing. Thank you. She says, awesome. You are so amazing. Thank you. I appreciate it. I hope I see y'all back Sunday, because I'll be going live Sunday at 4 p.m. Central Standard Time. Okay? And like I said, we went over a lot, you guys. We went over hypertension and cardiovascular disease. We went over women issues. We talked about fibroids. We talked about cysts. We talked about uterine issues. We talked about infertilities, menstrual cycles, abnormalities. We went over UTIs. We went over breast issues when it was about women with cysts in their breast, PCOS. We went over a lot. And then for the men, we went over erectile dysfunction, infertility, prostate issues, priapism. Priapism means that's when the penis stays hard too long and it's causing us a lot of pain. We went over different exercises to strengthen and tighten it, to tighten the vagina and produce vaginal secretions. Men, we went over how to strengthen your penis and how to elongate it and help it grow more and increase your libido. We went over fibromyalgia, lupus, multiple sclerosis, herpes, HIV. We went over a lot. And those videos with the content can be found on my YouTube channel at Higher Levels with Shay. Higher Levels with Shay. Went over kidney disease, acute kidney injury, chronic kidney injury, dialysis. I mean, we've been going through a lot. I do this 3 times a week. So 3 times a week is 3 different lessons. And so we've been hitting it hard. So, yep, Higher Levels with Shay on YouTube. When will you post the video with the caution acronym on your YouTube channel? I missed some of it. I will be posting, I'll go over caution right now, but I'll be posting this video, if not tonight, then tomorrow. It depends on how long I'm able to download this video. So if I'm able to download it, the sooner the better. And then I'll just post it to my YouTube channel. So sometime today and tomorrow. So caution, the C was for change in bowel and bladder. The A was for a sore that cannot heal. The U was for unusual bleeding or bruising. The T was for thickening of the tissues. So meaning like lumps, you're finding lumps. Okay. The I was for ingestion issues, like swallowing issues. The O was for obvious changes with your moles. So obvious change in moles. Okay? And the N was for a nagging cough or hoarseness. Nagging, like it's just there. You just can't get this you just can't get this cough to go away. So nagging cough or hoarseness. And so I will be going over this. Y'all have the website. Y'all have my YouTube channel. Y'all follow me on High Levels with Shay here. I want to be able to help y'all as much as possible. Yeah, we went over, pancreas cancer. That's in the video as well. Yes, we went over pancreas cancer and the herbs of pancreas cancer. C, yep. The C was for change in bowel and bladder. I think she's putting in the comments. A was for a sore that cannot heal, a sore or a cut. Yep. C, change in bowel and bladder. A was a sore that could not heal or prolonged healing process. U is for unusual bleeding or bruising. And that means unusual meaning blood in the urine, blood in the feces, coughing up blood. Like, unusual bleeding. So U was for unusual bleeding. T was for thickening of the tissue. So meaning you're finding lumps. So Shay is putting them in the comments. I was ingestion issues, so difficulty swallowing. So Shay is putting them in the comments, guys. So T was for thickening, of the tissues, so you find the lumps. I was for ingestion issues, meaning that you're having difficulty swallowing. And then O was for obvious changes in the mold. Like if you have a mole and you know it's an obvious change and its shape, you're starting to get larger. Or if you never had a mole and one just popped up out of nowhere. So O is for obvious change in moles. And then N was nagging cough or hoarseness. Yep, nagging cough or hoarseness. Thank you so much, Go Shay. I really appreciate that. So Shay, I'm sorry. Yep. And then the N was for the nagging cough. And then for the young lady who's in a comment about the pancreas, I'll go up to a few herbs. We talked about reishi mushrooms, turkey tail mushrooms. So reishi, R-E-I-S-H-I. We talked about red root and blood root. So red root and blood root. Red clover. And I mentioned chaga because chaga is simply amazing. C-H-A-G-A. That's another mushroom. Okay. Cranberries. Cabbage. Cranberries. Cabbage. You got your self-heal. That's H-E-A-L. Self-heal. And then for this pancreas specifically, wild ginger, plantain, so plantains, wild ginger, aloe vera. Aloe vera is amazing for a lot of different reasons. It's beneficial for lowering blood pressure. It lowers blood sugar. It grows your hair. It stimulates cell growth. Aloe vera is just amazing. It cleanses your skin. I mean, aloe vera just does it all. Yep. Aloe. Bilberry. And Ella Campaign. That's ELECAMPANE. Yep. And then ELECAMPANE. Kudzu, KUDZU. So that's just being specific, okay? If that's it with all of the questions, I will see y'all back Sunday at 4 p.m. Central Standard Time. I didn't want to leave out of here without helping that young lady out another few times. That was like 3 times she asked me about pancreas. And so I was like, you know what, let me just go ahead and give it to you. You are so welcome. Make sure y'all share live. And if y'all follow my YouTube channel and subscribe and y'all like the video, share it to your social media. Because each one of us has to teach somebody. And so I just really want y'all to share the links. Can you share it through a text, through Facebook, in a DM? I don't care how you do it. If you tag somebody in a comment on the YouTube channel, if you have a testimony under the YouTube videos, whatever you could do, but help me spread the word, okay? Please, can you say if getting small warts are serious? Yes, that is serious. I think not. Let me make sure I'm answering your question correctly, though. I want to say small warts is serious when it comes to cancer, but you have to get that checked out. So do go to your doctor and get tested for warts, okay? All right, because warts are a sign of that's abnormal, okay? So I'm not gonna say warts is cancer. That's not what I'm saying yes to. Am I saying that it's serious? Go get it checked out so that you can get rid of the issue, okay? Thank you so much. I appreciate you. I also heard about the purple orb. I would love your thoughts on this. I'm not for you mean for cancer or just in general? I mean, that's something new. I would love to learn more about it myself. I will learn to look more into it. But that isn't like normally one of the go-tos when we're discussing cancer, because like I said in the beginning of the lab, cancer is so dangerous and it spreads so rapidly. So you want to give the strongest and the best herbs that's going to be the most effective, the quickest. You see what I mean? So she said Sunday at what time? 4 p.m. Central Standard Time. So 4 p.m. Central Standard Time is when I'll be going on Sunday, okay? And we're talking about blood types. Yes, sour sauce. Oh, listen, sour sauce. Y'all just gave y'all the herbs. Now, if y'all want the fruit, lemon, lime, papaya, sour sauce. We're talking about apricots already. So if you all want the fruits, then absolutely sour sauce, lemons, lime, watermelon, papaya. Papaya is amazing. Yes. Cocoa nuts. Yep, sour sop, lemons, limes, watermelon, papaya, apricots. Can't forget the apricots. You want to talk about vegetables? Cayenne peppers. Cayenne peppers are amazing. Yes. Yes, it's amazing. And then we already mentioned all the mushrooms, the chaga, the lion's mane, the turkey tail, the reishi. So we talked about those. So we're going to talk about, somebody asked, how can you get rid of eczema and dark spots on fruits? So here's one thing with eczema. Eczema is not a skin issue. Eczema is an allergic reaction. Eczema is actually your skin's defense mechanism for something that you eat and it's trying to get rid of it. You have eosinophils in your body. Eosinophils are usually those white blood cells that wake up when it's an allergy. And so I tell everybody when they're talking about eczema, it is not a skin disease. It's an allergic reaction. When you find out what it is you're allergic to, you can cleanse yourself of the eczema. You see what I'm saying? And so we'll discuss eczema and we'll discuss the remedy of eczema with a whole bunch of different skin issues like impetigo. You see what I'm saying? Acne. We're going to go through a lot of different skin issues when we all at once when we go over skin. But eczema is one that I tell everybody, yes, it's a skin issue, but it's an allergic reaction. You find out what you're allergic to and watch how you not really having any signs of your eczema. And that's what the doctor don't even tell you, that it's not a real skin issue. It's a allergic reaction. And we'll talk about fruits, so like bananas, pineapples, all that stuff is great for your skin. So we'll talk about fruits, we'll talk about herbs, we'll talk about it all. Your kids was not born with eczema. They was born with a lactose intolerance, and that is an allergic reaction to the lactose. So you're not born with eczema. You're born with an allergy to something. And eczema is just your body's defense mechanism. So instead of them having, like, let's say for instance, like if somebody is allergic to coconut and they get like a sore, itchy throat, they don't necessarily get eczema, but they got an itchy throat, or they get swelling of the tongue. You see what I'm saying? So you're not born with eczema. That's just your body's response. You see what I'm saying? To an allergy. And if your children are lactose intolerant and they taking in that lactose and their bodies are breaking out, I tell people to actually be grateful that it's coming out through their skin and not, like having their throat closing up, causing breathing issues, or their tongue swelling, or their lips swelling, or their eyes swelling. You see what I'm saying? And so I just want to reverse like a lot of myths. I don't really call them myths, but it's just miseducation. And I want to give further, deeper education to the masses so y'all can just have a better informed decision. You know what I mean? Yeah. That's good, Christine. Yeah. So your children were born with an allergy, and that was their body's allergic response. Okay. All right, y'all. I love y'all. Y'all better remember, I'll see y'all at the next family reunion, and that is gonna be Sunday at 4 p.m. Y'all better give God all the glory to have y'all here another day with us, and continue to walk in your purpose. And I'll see y'all back here on Higher Levels with Shay. All right. See y'all Sunday. Have a safe, and blessed weekend. All right. Bye, family.
'Cause that is what my heart says. That's what my heart says. I wanna be with you always, always, yeah. You are my world in every place. Oh, oh, oh. It's the things that goes by. I know I'm in a better place. I'm in a better place. Oh, oh. It's the things that you do. It's the things you do, baby. It's the smile on your face, smile on your face. And as time goes by, I know I'm in a better place. A better place, in a better place. It's the things that you do. The things that you do. It's the smile on your face, the smile on your face. And as time goes by, I know I'm in a better place. A better place, in a better place. I wanna be with you always, 'cause that is what my heart says. That's what my heart says. I wanna be with you always, always, yeah. You are my